Sports-related concussion is one of Dr. Rebecca Reedy's areas of research. With football season upon us, I spoke with the University of Massachusetts Amherst professor about chronic traumatic encephalopathy, more commonly known as CTE. That's the degenerative brain disease that's been found in athletes, military veterans, and others with a history of repetitive brain trauma.
CTE, which is a very new and poorly understood construct, is associated or thought to be associated or linked with both cognitive impairments and psychiatric symptoms, depression, anxiety, aggression, things like that. So a host of behaviors. What's complicated is those behaviors are not specific to CTE. They're symptoms of other common disorders.
So at this point, because the research is so new, it could be that these other things like emotional outbursts, for one, that's often commonly linked with that, could be coming from something else we just don't know yet.
Probably multifactorial. Probably a lot of factors come into play as to how an adult behaves and feels. And a history of head injury may be one of many factors that come into play. I think CTE and head injury has really become just stolen the headlines. It's become a really sensational story, and I think the story in the media sometimes is out ahead of the research.
And how long has this research really been going on, where the medical society community has looked at it and thought, this is something we need to pay attention to?
That's a great question. I'd say in the past 10 years, the research has advanced tremendously. Maybe great research protocols were introduced about 15 years ago or so, so it's new. And the prospective, controlled research that we need to really understand the effects of multiple concussions on behavior really hasn't happened yet.
And is that a function of we need more time to do the research, we need bigger studies? What would you say?
All those things. Absolutely need more time. You need research groups that are prospectively enrolling random samples of athletes from a variety of sports and studying the long-term prospective consequences, as well as lots of other things we know contribute to brain health and emotional health, like health, obesity, substance use, smoking. All these factors are not well understood in how they interplay with head injury and affect later behavior.
Because as you say, right now it's being pegged to football, but that's controversial because there are some people who say that we're overlooking the fact that these people are injured and we're sort of sitting down to celebrate this as a sport. But then on the other side, there are coaches and parents who point to this is great for teaching kids discipline, how to work together, a variety of things.
Absolutely.
So it's a tough issue at this point.
It's a tough issue, and I think the conversation's been a little bit obscured by sensational cases in the media.
Aaron Hernandez from former New England Patriot being one of those.
Yes. And those cases are tragic, and we really need to understand what's the cause of these cases, what's going on, what might lead to a former athlete having these really severe outcomes. But we also need to keep in mind that for every one or two of those sensational cases, there's tens of thousands of former athletes, football players, hockey players, who are thriving and living into old age and are healthy. On average, retired football players from the NFL have lower rates of suicide. They're healthier. And you don't hear these stories as much. The counter argument. And I appreciate your point too that youth sports is incredibly valuable, and we need to be safe with our children and have the right guidelines for injury and practice times and the amount of contact and practice. There's lots of ways that we can protect our children and also support youth sports.
And also one of the things, as I understand it, that's a little confusing or or something that's not well understood at this point. CTE is diagnosed only after death right now, right? Yep. But there was some reporting, I think, about a year ago about a new protein that could be a certain marker for folks. It was the CCL11 protein. Not that I'm intimately aware with it.
I'm not intimately aware with it either. Yeah.
But testing for that protein could be an indicator. Do you know anything more about that?
Well, I think that's almost, I don't know. That's not in my area of expertise. But, that would be, I presume that would be an ability to test for tau accumulation, which is the marker, the brain sort of protein. The accumulation of tau is the marker on autopsy of CTE. So the pathways there are multiple, and we don't know how much head injury plays a role. And on the other way, the pathway from CTE to clinical indicators of behavior, such as depression, anxiety, suicidal ideation, are not known. So the amount of tau accumulation in a brain doesn't map on or tell us anything about clinical presentation. So there's so many directions in which we don't have good evidence yet that even another marker of a tau accumulation in the brain might or might not help us eventually discover what's going on.
You also said that you're working sort of in tandem with students on this issue at UMass.
Yeah.
Are there things that they're bringing to the table that have stood out to you as something that's really of interest?
Yeah, I have students coming in, graduate students doing research on concussion who are bringing in really novel ideas about trying to understand what might underlie emotion dysregulation, what might be, if indeed head traumas are linked with greater depressive and anxiety symptoms, what might be going on there. And another graduate student who's looking at university students who suffer concussions and how that might impact their academics and how we help keep them on track during that recovery period, because it can really be derailing when you're coping with the immediate effects of a concussion.
Just very briefly, in the short time we have left, looking forward a year, 5 years from now, information that you hope that we'll have about CTE that we don't now.
Well, I hope we have more research labs replicating the primary findings that we're discussing on CTE. Right now, they're coming out of one research lab in Boston University, right? So I would really love to see replication in other independent research labs. That is the core feature of good science. We need other people to replicate what they're doing. So that would be one. I also think we really need good prospective studies that enroll good control groups. So, for example, we're not just studying at autopsy the brains that are brought to, for example, BU by families whose loved ones were having behavioral problems, but rather a more representative sample of former athletes.